Hi everyone, good Wednesday afternoon and welcome to Smart Health with the Warren Alpert Medical School at Brown University. I would like to welcome in now our second guest for the new show, Dr. Wafik Deiry. Thank you for joining us today here in studio.
It's a pleasure to be here.
I appreciate your coming in as the inaugural Associate Dean for Oncologic Sciences. We're going to talk cancer. Now you joined Brown in January, so tell us what brought you to Brown University.
Well, I saw a great opportunity to build cancer programs. We have a great university, a great medical school. We have a school of public health, and then we have a number of affiliated hospitals, including the Lifespan Cancer Institute, a children's hospital, Rhode Island Hospital, several hospitals. I met a number of great colleagues here and thought that this would be a great environment to build cancer programs.
And you've had a storied career so far. And tell us a little bit about the advancements you found in your research, both with breast cancer, brain cancer, and more.
Yeah, so I'm a physician scientist who runs a basic science lab studying cancer, and I also see patients. And so we've been interested in finding new treatments for cancer, and we focused for a number of years on how cancers grow, what are the effects of chemotherapy or radiation on the tumors. And we've always believed that if we understand these processes, we could then design drugs to boost the immune system or get the tumors to die, and that's what we want to see in our patients. And so I was very fortunate in being involved with drug discovery over the last 15 years, and had one of the really most exciting things that can happen in the career of a physician scientist, which is to discover a drug in the lab and have it move to the clinic, and then see and hear about patients who are having responses, for example, with brain tumors or other types of aggressive tumors in clinical trials when there really aren't any other options. And so at the moment, there is a drug that came out of the lab. It's in a number of clinical trials, and our group is trying to understand more about exactly how the drug works and how to combine it with other drugs, and who benefits and who doesn't benefit. And so this keeps us pretty busy.
I can imagine. And what does it mean to be here, doctor, in Rhode Island, looking perhaps at a specific population? Rhode Islanders in particular, if you're looking at here in this geographic area, what does it mean to look at cancers as it pertains to, again, that local population?
Well, every area has different demographics or different cancer rates in different geographic locations. So interestingly, Rhode Island has higher rates of certain tumor types. I was interested to learn that bladder cancer is fairly common in Rhode Island. It is really the place with the highest rates of bladder cancer in the country, and higher rates of other tumors like lung cancer and breast cancer and thyroid cancer and a few others. In terms of studying a population in a specific location, there are other issues that are important, such as access to care and screening, prevention of cancer. Are people at risk being screened, and are they getting the latest technologies to help them do well in the long run? And so by way of example, I hadn't been here for a few weeks, and a group of us from the Lifespan Cancer Institute went to Central Falls, which I learned is a very densely populated city, one of the most densely populated places in the United States. And we visited the mayor's office, and we talked that day about lung cancer screening. And, there was a national so-called lung cancer screening project where individuals at high risk of cancer were screened with CAT scans.
Okay.
And in the state of Rhode Island, more than 800 were screened. But interestingly, only 4 from Central Falls were screened, which immediately brings up issues of, why is that? What are the barriers to screening? Because of course, if we screen for cancer and detect it early, we have a much better chance of curing it. And so, we're learning about issues like that would help us take better care of the population in Rhode Island.
Now, you mentioned higher incidence of certain types of cancers. One of the things you do often hear in the news is the term cancer cluster. I mean, is that a scientific term? And as it pertains to Rhode Island, let's talk about those prevalent cancers. Are they focused in particular areas? And how does the medical community, again, respond when they see A, a particular type of cancer, or B, it existing in a particular geographic area?
Yeah, so the idea of cancer cluster has to do with noticing that certain cancers are popping up in certain locations. And I would say what I mentioned a little bit earlier is that there are definitely higher rates of specific types of cancer, such as bladder cancer in Rhode Island. And then so, one would start to think about, well, what could cause that? Rhode Island and Providence has a long history as far as the Industrial Revolution and the jewelry industry, and so one thinks about heavy metals. There's also a history of toxic waste that may have something to do with cancer rates. There's radon, and there are also, of course, genetic factors. And so what we know right now is that certain types of cancer are increased in the state of Rhode Island. And the next step is to figure out where exactly is it located geographically, and what can we learn about the tumors that have occurred in Rhode Island in terms of their genetic signatures, to try and begin to understand whether there may be environmental factors or potentially a combination of genetic factors as well as environmental causes for these increased types of cancer.
Now, you talk about having that drug go forward to clinical trials, and of course you hear folks talk about that great cure for cancer. With these advancements, especially yours in the pipeline, I think folks are curious, how close are we to major advancements, major breakthroughs? Again, is it addressing it at that tumor level? And are we going to see in the coming years, again, those types of breakthroughs that will really address cancers across the board, both here and across the country?
Well, this is an exciting time to be in the field of cancer research and to see the advances that have been coming along over the last few years. And I would talk about a couple of things. One is there have been incredible advances with immunotherapy over the last few years. Now, not everyone benefits from immunotherapy, and in fact, one of the big questions is who benefits and why, and how can we have patients benefit long term? And there are plenty of clinical trials combining immunotherapy with either chemotherapy or other forms of targeted cancer therapy. So this is an area where we're going to see more happening as far as both clinical trials as well as, we hope, progress in terms of those long-term outcomes. Another area that is very much on people's minds and has resulted from advances in understanding the genetics of cancer have to do with what's referred to as precision medicine or precision oncology, in that for tumors to develop, they need to acquire certain mutations, and if we knew what the mutations were that drive the cancer, we could treat the patient with specific drugs that are tailored to their genetic drivers. And so a lot of progress has been made, and we do have a number of examples of tumors that are now treated specifically based on the genetics of the tumors. And we've also had advances in kind of the molecular testing of tumors, so we can uncover these vulnerabilities. Cancer is complex, and even within a certain type of cancer like colon cancer or breast cancer, it's many, many different diseases. In fact, it could be said no two tumors are exactly alike, but there are some common themes in terms of how they're treated. And I'm somewhat optimistic about the prospects of new treatments for cancer, especially when we bring in immunotherapy, because immunotherapy has the ability to attack every last cell of the tumor and get rid of it. But one of the challenges, frankly, is that the cancers evolve, and it's this type of battle that goes on with you bring in a treatment, the tumor evolves, and so we have to continue to be ahead of that by studying how do the tumors become resistant, who benefits, so we can give the right patients the right treatments, but also have a plan for what to do when and if the tumor evolves and starts to grow again.
And you raised a point that I want to address because we like to talk to our viewers here. Again, it's that screening process. So folks who are watching, you talk about high prevalence of certain types of cancers in Rhode Island, but what should the viewer, the average Rhode Islander, know about cancer screening? Again, risk factors from either genetics, again, or geography, all the way through symptoms. I mean, when should someone be seeking out that screening process? Because catching it at its earliest stages, I'm sure, is key. So what should viewers know?
Well, it's important to start with family history is pretty important. If there's a family history of cancer, it's usually known by family members, and in fact, whenever a loved one develops cancer, it becomes known by the family, and different family members will speak to their physicians about that and will undergo screening that's now tailored to their history and risk. I would say, so I do want to, I am a colon cancer doctor, and so I will always bring up the idea of screening for colon cancer. The American Cancer Society used to recommend screening beginning at the age of 50 for the general population. In the last year or so, they've lowered the starting point to about 45 years of age. And colon cancer is completely curable if caught early and removed. And so one of the things that needs to happen in addition to making sure you're screened, and I can tell you that I have seen plenty of patients in their 50s, 60s, and 70s, often who have never had a colonoscopy. And the tumor grows, it spreads, and by then it's very hard to treat, and it's not curable. So this is something simple, and there are national goals. And wherever you go in the United States, and this area is no different, not enough people do get screened. But the other thing I will say is don't ignore symptoms of cancer or specific types of cancer, and just some general guidelines would be to pay attention to unintentional weight loss. Lots of people are trying to lose weight, and when all of a sudden it's just happening without trying, that's something to be concerned about. Unexplained fatigue or unexplained pain that persists for weeks and weeks, or certainly any kind of bleeding or bruising or those types of symptoms, get checked out. Interestingly, in my specialty with colon cancer, we're seeing more younger people develop colon cancer, and nobody knows exactly why. It may have something to do with the diet or obesity, or maybe the bugs that live in our gut may have something to do with it. But if you think about it, when younger people develop symptoms of colon cancer, they're much more likely to ignore them or pass them off as not significant. And anything that persists and lasts, get it checked out, because cancer does affect younger people occasionally, and we're seeing it in certain types of cancer. And so just pay attention to the warning signs, get checked out, talk to your doctor. And certainly if you have a family history, that is often a clue as to what to watch out for.
And you mentioned talking to your doctor. Again, those general symptoms, is it see your general practitioner first, and then they would, in fact, refer you if they believe there's something to look into further?
Yeah, that is a good place to start, but be persistent if something really is not explained.
Okay.
Just because I wouldn't let anything go too long. We all have illnesses that last 2 or 3 weeks, but if you've had something going on, an unexplained cough or some ache that in your back that is not getting any better and is unexplained, get it checked out.
Well, I appreciate your taking the time to come again as you start in on your career here at Brown University to talk straight to folks with Smart Health. So Dr. Wafik Deiry, I appreciate your taking the time to come in today.
Thank you very much.
And appreciate your watching Smart Health. We'll be back tomorrow with more GoLocal Live. Of course, catch us on Facebook and on GoLocalProp.com throughout the evening and the morning. And we'll see you tomorrow. I'm GoLocal News Editor Kate Nagel.